Will be on addictive behaviors in the Netherlands. So culture, smoking habits, and alcohol. So Netherlands has what is known as a wet culture, and that basically means alcohol is integrated into daily life and activities. It is consumed with meals, and it's widely available and accessible. So their social climate on alcohol has been modernized. So there's not such a harsh stigma against it like in the United States, because here it's often associated with just negatively. So because it's been modernized in the Netherlands, people drink alcohol without problems because they have personal control measures. They know that one drink will not lead to binge drinking. In terms of smoking habits, approximately 20% of those 18 years or older smoke. Smoking is banned in enclosed public spaces, at work, and the hospitality sector, but it can be done in open public spaces. Consumption habits in the Netherlands. So 17.5% of young adults have tried cannabis, and that is the most common illicit substance used in those from the ages of 15 to 64. 7.1% of young adults have tried ecstasy, and 4.5% of young adults have tried cocaine. So the Netherlands has adopted an Opium Act of 1976, which states drugs of low risk, like sleeping pills and marijuana, are soft drugs and they will receive low penalties. Heroin, cocaine, and amphetamines are hard drugs which will receive high penalties. So they know that drugs exist, they normalize them because they know using illegal drugs is inevitable. People will use them. And just a fun fact about the Netherlands is that coffee shops is where actually cannabis is sold and consumed. So this is just a screenshot of the drug report in 2019 that just shows visuals of what I explained in the previous slide here. So the prevalent health issues in the Netherlands is cancer, cardiovascular disease, Alzheimer's, respiratory disease, and behavioral disease. So cancer in men is the main cause of death, while cancer and cardiovascular diseases are the main cause of death in women. So connections between substance use disorders and illnesses. So since 1982, there has been surveillance on HIV and injection drug users, and this is because injection drug users use needles and syringes, and they often reuse them or share them amongst each other, and this causes, diseases to spread. So because of this, the Netherlands has implemented a needle exchange program where you can basically get new needles to reduce the likelihood of spreading diseases. So as of right now, approximately 1,400 HIV-infected drug users are in the Netherlands, but this value is expected to decline. And then those with substance use disorders are typically diagnosed with psychiatric disorders such as schizophrenia and psychosis. So some risk factors of addictive behaviors can be genetics, your environment, dual diagnosis, and your personality traits. So starting with genetics, that's the only one that you can't change. So if a family member of yours has been addicted to drugs, alcohol, or they just have addictive behaviors, you are more likely to experience it as well if you are the child of someone who does that. Second, your environment. So being around family and friends that normalize the use of drugs may cause you to think that it's okay to use drugs and it isn't a big deal. Another part of it too is peer pressure from your peers. If you're at a party and everyone's doing it too, you might feel awkward not doing the same things they do. So peer pressure can lead to addictive behaviors. Another aspect is dual diagnosis. Those who already have a mental diagnosis and an addictive disorder, that will increase your risk toward addiction. Another aspect is personality traits. Those who are impulsive, hopeless, sensation-seeking individuals are at risk as well. And the last thing that I didn't mention is age. So if you start using drugs from a young age, as you get older, your brain starts to learn how to function with drugs, and without them, you kind of spiral out. So age is a risk factor in determining addictive behavior. So the solutions. So the ones in black are the ones that the Netherlands has already thought of and they've implemented, and the ones in orange are the ones that my advice. So The Netherlands has a healthy school and drugs program, which basically targets elementary school students, and they focus on the social norms, impulse, and self-regulating control. The Netherlands also plans to ban the sale of cigarettes from supermarkets in 2024, basically to try to encourage people to stop smoking. And then my primary prevention that I thought of was allowing children to see the dangers of addiction, such as the living conditions that addicts live in, mental health positions that they're placed in, and basically their health outcomes and how they're at risk for, more diseases and dying. And then my secondary prevention that I thought of was offering drug testing centers in which people can get their illegal drugs tested, because oftentimes an individual will purchase like cocaine and it's often laced with something else which can lead to death. And the last thing I thought of was a needle exchange program and also providing Narcan to individuals.